Prediabetes is often dismissed as a mild condition, a sort of gray area between health and disease. But for men, especially those thinking about starting a family, this mindset could be dangerously misleading. Mounting research now reveals that even when HbA1c levels fall just below the diabetic threshold, reproductive health may already be compromised. The damage doesn't wait for a full-blown diabetes diagnosis. Hemoglobin A1c, HbA1c, reflects average blood sugar over several months. While doctors often consider anything under 5.7% as normal and only become concerned at 6.5% or higher, new studies show that reproductive harm can begin much earlier, even at HbA1c levels between 5.7% and 6.4%, the so-called prediabetic range. This range is increasingly common in men under 40, and yet its impact on fertility is rarely discussed. Men in this metabolic state often feel fine. They might not be overweight, and their testosterone levels may still fall within normal limits. But under the surface, elevated blood sugar is already creating oxidative stress in the testes, impairing sperm development and disrupting hormone signaling at the cellular level. The result? Lower sperm counts, reduced motility, and abnormal morphology, all critical factors for natural conception. Even DNA fragmentation in sperm, which increases miscarriage risk and lowers embryo quality, appears more frequently in men with prediabetic blood sugar profiles. The effects are subtle at first. A man may not notice any change until he and his partner struggle to conceive. Then come the expensive fertility tests and medications, sometimes without clear answers. Yet one of the most powerful variables may have been overlooked entirely: his blood sugar. There's an important warning here. Male fertility is not immune to metabolic dysfunction. In fact, the testes are especially vulnerable to the damage caused by glucose-induced inflammation and poor circulation. And since most men don't regularly monitor HbA1c unless already flagged for diabetes, many are unknowingly compromising their reproductive potential, often during peak reproductive years. But this is also a call to action. Unlike many causes of infertility, the damage from prediabetes can often be reversed, or at least improved, with meaningful lifestyle changes. Lowering sugar and refined carbohydrate intake, increasing physical activity, improving sleep, and managing chronic stress can help restore insulin sensitivity. In many cases, sperm quality improves within just a few months of better metabolic control. For men planning for fatherhood, or even those simply wanting to preserve long-term reproductive health, the message is clear. Don't ignore prediabetes. It's not a harmless warning. It's a metabolic condition that could silently sabotage fertility. Get tested. Take your HbA1c seriously, even if it's just a little high. The window for intervention is real, and the benefits go far beyond reproduction. Better blood sugar control supports cardiovascular health, energy levels, cognitive function, and sexual performance. In short, it's not just about having children. It's about being healthy enough to raise them. Don't wait for a diagnosis to start paying attention. Prediabetes isn't silent because it's harmless. It's silent because we haven't been listening.